Today we're going to talk about heartworm disease and how we treat heartworm disease and the ways that preferably we can do to prevent it. I brought Remus today. This is my own personal golden retriever. He does not have heartworms, but I did just want to use him as an example to show when we diagnose a pet with heartworms what we do. And so let's say we did an annual. We send out a heartworm test with every single annual. Whether you do our discounted blood work with an annual or just a plain annual, you get a heartworm test. And if that test comes back positive, typically what we recommend to do is what's called a confirmatory test. So we send a test to the lab, again, different than the test that was sent the first time. It's a heat-treated heartworm test that they will then look at. And if that test comes back positive, it's a confirmation that your dog has heartworm disease. Heartworm disease is a deadly disease, not necessarily, immediately, but if they have it for years and years and years, it can lead to something called cable syndrome. And so the longer that those worms are existing where they are, the more damage they're going to do. So you want to get rid of them the fastest way you can, and the fastest and most effective way to do it is through an injection series that we call imidacide injection. The actual drug is called melarsoline. And so once we diagnose your dog with heartworms, we're going to start them on an antibiotic called doxycycline. We'll do that for a month. That antibiotic kills a bacteria that lives inside of the worms called Wolbachia. So we kill off that bacteria, so then that way once the worms start dying off, that's not still there. You finish that antibiotic, so then you take a month off. After that month off, you do injection number 1, and then you take another month, and then you'll do injection number 2. 24 hours later, you do injection number 3, and that's the last of that series. Throughout this whole time, they have to be cage rested the best that they can, or just still in the house. If they're normally a pretty chill dog, that's great. But we don't want them running around, jumping around, having a good time, anything to increase that heart rate, because there's still damage there and there are actively dying worms in the process that we don't want to anger their heart in any sort of way, because it can be catastrophic.